start talking about muscles of the trunk. These are muscles that essentially, if we're worried about the when they contract here, they're going to move the vertebral column. They're going to be paired muscles on one side of the vertebral column and on the other side, so left and right parts of the vertebral column. There's a whole bunch of muscles, and depending on what they are, you need to know. If you're interested in lumbar vertebrae, if you're interested in thoracic vertebrae, if you're a thoracic specialist, you would need to know those particular muscles. But we're not there, and I'm not going to ask that. So that if you go and you look in the book or you go online, you're going to see a whole bunch of different details. The simplest one is that there's going to be a series of columns. They're called the cervicus, longissimus, and the iliocostalis here. Generally speaking here, what happens is one muscle begins and starts somewhere and ends, and then another muscle begins right there and ends somewhere else. And so it goes either up or down the spine. We're going to be calling that group the erector spinae group. So that if you were to go online, the erector spinae group has got a series of 3 muscles here. These are the 3 muscles. The erector spinae group is not, I'm not going to be worried about the origin, insertion, and action of them. Okay? So this is a large group of muscles that extend from the sacrum all the way up to the occipital bone, and they have other attachments along the way, but it's basically right up and down the column. If you look at the pointer here, used to produce erect posture, so that if you're standing up straight, right, those erector spinae muscles are going to be the ones that are contracting. The erector spinae come in 3 groups here: the iliocostalis, the longissimus, and the cervicis. I'm not going to ask you to the individual portions of the iliocostalis, longissimus, or the cervicis. Right? I'm not going to ask you those. I might ask you to recognize that the erector spinae comes in 3 different groups. There's basically low, medium, and high. I will ask you to identify them, and if you look on the right-hand side here of this diagram, these are all deep muscles of the back, and they're essentially doing the same thing. So if you look, if the muscle starts down here inferiorly, they go more or less parallel to the midline, and then they stop, they insert somewhere, and then another group of muscles start where they end off, and they go more or less parallel to the midline. And so a rule of thumb is that if you see a muscle that is parallel or nearly parallel to the spinous process of the vertebrae, just say that's erector spinae muscle. Now, if the question is about 3 parts to the erector spinae muscle, then here are the 3 parts: the iliocostalis, the longissimus, and the cervicis. Again, these are the muscles that are in the low, medium, and high. The longissimus generally are in, well, they're not, they're different parts there, but these are the 3 main areas, okay? So the 3 main areas of the erector spinae are the iliocostalis, longissimus, and the cervicis. These muscles all more or less run parallel to the midline of the body. They will extend the back or produce erect posture. And the other details associated with this are not really important. Another group of muscles that I haven't mentioned about are muscles associated with the intercostals. And so the intercostals are muscles that are sort of analogous to external and internal obliques. They're external and internal intercostals. These muscles will help with elevating and depressing the ribs. But again, because they're if you're on one side of a rib, that's the origin of one muscle, and if you're on the other side of the rib, that's the insertion of the same muscle. These muscles, I'm not worried about the origins and insertions. What is the term external and internal mean? The external intercostals run parallel to the external obliques. The internal intercostals run more or less parallel to the internal obliques. And in addition, the external are superficial, the internal are deep. They work in concert with the diaphragm. The diaphragm is a combination of both voluntary and involuntary musculature. And so these 3 muscles here work together. So I'm not as worried about the external and internal, the origins and insertions of them. I am worried about what they're helping doing, their actions here. There's inspiration or expiration, inhaling or exhaling. And in terms of the diaphragm, all the diaphragm does is raise and depress, raise and depress. So the diaphragm, and I won't go into this in any great detail, but if the diaphragm depresses, it increases the volume of the body cavity, and as it, the thoracic cavity, and as it increases the volume, air rushes in. And then when it elevates, it decreases the volume of the body cavity. As a result of it decreasing the volume of the thoracic cavity, the pressure is greater in the lungs than outside, and so then you expire, you exhale. So it's all related to pressure at our current atmosphere, so that if it's less than the current atmosphere, if the pressure inside the lungs is less, air rushes in. If it's greater, air rushes out. And that's all that you're doing. That's all that happens. In other words, you don't force air in or out. You do it because of related changes in air pressure. There is also forced expiration. That's when you're breathing very heavily, but that's a different thing. Again, now these external, if you look in the upper left-hand corner here, there's the external intercostals, again, more or less parallel to the external obliques, and then the internal intercostals are perpendicular to them. Now we have walls of the abdomen and the abdominal walls, and you know a couple of them already, so we can go through those. The one that is parallel to the midline and beginning right at the midline there is the rectus abdominis. I didn't talk about the origin and insertion, and the origin and insertion is easy to talk about here, and it is another example of one that goes counter to the rule that I provided yesterday. The origin for the rectus abdominis is the pubic crest or the pubic symphysis, so some version of the superior ramus of the pubis, any version of the pubis, that's the origin. The xiphoid process and the inferior ribs is the insertion. So then what is it doing? It's going to be compressing the abdominal wall and flexing the vertebral column. The external and internal oblique are the muscles that run at an angle to the body length, the body line, and the external is going to be superficial to the internal. They run from the ribs to the iliac crest. And so then if you put your hands on your ribs and your back and you run your hands toward your front, that's more or less the angle of the external obliques. And if the external obliques are running this way, the internal obliques are running perpendicular to that. So the internal obliques then start down here in the hips and they reach up to the ribs, and the external obliques start at the ribs and reach down to the hips or down to the os coxae. I'm not as worried about the origin and insertion for them, but I am worried about the point of attachment. And then the one that's really different is the transversus abdominis, and that's the deepest level of the abdomen. The transversus abdominis, if you look at this is a circular muscle. It starts in the back, it goes all the way to the linea alba, and you see right here the linea alba, and then it goes around back to the other side. So the transversus abdominis is basically an abdominal muscle that cuts the body into a transverse plane, and it acts like a seatbelt. Another thing that remember when you're talking about these actions here, so that if you have one portion of the muscle, one portion of the abdominal muscles contracting, you'll pull the body in one direction. If you have both of them contracting, you pull the body in another direction. So in other words, they're unilateral or bilateral movement. So in the same way as with the sternocleidomastoid. Just diagrams here so that here's a superficial one, this is a little bit deeper, and then this is deeper still. If you look up here at the top of this diagram, this is, sometimes people look at this and say, what the heck am I looking at right here? Well, you should be able, if I show you this view, right, you should be able to tell, regardless of what side of the body it's from, you should be able to tell what layers of muscle it is. Because this is superficial fascia, here's the integumentary system. There's fat right here, This has to be the rectus abdominis. This has to be the linea alba. Right here, that's the only muscle that's paired on either side. Right here, external oblique, internal oblique, transversus abdominis. And here's more pictures of this. If you look on the left-hand side, this diagram right here with all the different muscles shown right here. My point that I want to make here is that make sure that you're looking carefully at the diagram. Make sure you're looking at what the pointer is pointing to. Because when we talk about these muscles here, or when I show you diagrams of them, I tend not to show you diagrams of cadavers. They're not nearly as clear. So that gives you a feel for most of the muscles or the muscles of the axial skeleton. Are there any questions about that? So now here's a problem. I'm going to continue on with the pectoral girdle, and we're going to talk in a minute, right? But here's the problem about the axial skeleton. So you have all these muscles, the location, the origin, insertion, and some actions, right? Some origins, insertions. A lot of these muscles should be familiar, especially the muscles of the head and the abdomen. The muscles, this is only, let me see, what did I say here? This will only be about a little less than a quarter of the, no, this will be a quarter of the exam, this one portion of the lecture, okay? The lecture I'm about to give and the one for tomorrow, that will be another quarter of the exam. The muscle tissue lecture will be, or chapter will be another quarter of the exam, roughly speaking. And then the joints and articulations will be another topic as well. And that'll be a little bit less than a quarter of the exam. So my point here is that you're going to have a lot of muscles and there's not a lot of questions on it. Right? And there's a lot to know there. Okay? Identifying muscles that you're really familiar with and you know about the origins, insertions, and then identifying muscles, what the hell did he say about that? If you do that and you ask tomorrow, we can go back to, we can revisit this lecture if you want. Right? If I said something, if I was confusing or whatever, we have time tomorrow to do that. Let me switch here. Once again, this is the same chapter, so the same 4 or 5 slides here about the general vocabulary associated with muscles. I don't want you to forget about those, right? But I'm not going to talk about it. Whether it's the prime movers and synergists or the naming of the muscles and the arrangement of the fascicles. We're worried about the muscles of the pectoral girdle. And we'll start here with the trapezius muscle. Wait a minute here, didn't we already talk about the trapezius muscle? So the trapezius muscle is one that we have already talked about. And it's associated with the superficial back, right? So we don't have to talk about that. I have a number of different diagrams from old lectures here, and this here is a picture of that's really helpful, hopefully, for you to identify muscles. On the left-hand side, first thing to look at here is for any of these diagrams, automatically say to you which is superficial and which is deep. So which side of the body is superficial muscles?
Left side of
the left side, and so the deep muscles are on the right. Right? So the deep muscles include the rhomboides major and minor here. You have a couple of the triceps brachii. This should be the serratus posterior, or the serratus anterior rather, excuse me. On the left-hand side, you have the trapezius, the deltoid. Both those will definitely be on the exam. You don't, because the deltoid is covering the spine and the scapula and stuff like that, you can't see the supraspinatus, so that if I were to go like this and to pull up or to pull down on the trapezius, and we can expose this part right here, we could get to the supraspinatus. But for right now, because that's covering it, we have the infraspinatus. Then there's 2 other muscles right here, one of which they are both teres muscles here. So the teres minor is part of the rotator cuff, the teres major is not, but it's really, really close. So when you're talking about muscles that originate on the scapula and go at some point to the humerus, here, and to the, right really close to the head of the humerus, and we'll talk about more specifics in a minute, but we're talking about 5 muscles here. There's a muscle that's anterior to the scapula, and that's called the subscapularis, and you can't see that here. There's a muscle that's superior to the spine of the scapula, that's sort of supraspinatus, so that's 2. Then there's the infraspinatus, the teres minor, and that group of 4 is the rotator cuff, and then the 5th one is the teres major. The teres major is the one that is the biggest one and most inferior and most obvious. Where does it start? Right here, it starts at the spine of the scapula. Where does the infraspinatus start? It starts either, I'm sorry, not the spine of the scapula, the inferior angle of the scapula. The infraspinatus either starts in the infraspinous fossa or the medial border of the scapula. Where it lets its insertion, it's going to be on the head of the humerus or on the humerus. Okay? And by a long time ago, I used to teach this class with particular emphasis on cat dissections, and cats were jacked right here. They had really, really tiny pectoralis muscles. They had virtually no pectoralis muscle. Their pectoralis major was really, really, but their triceps muscles, some of their hip muscles were amazingly, they're huge. And so that's just a difference. Now, in terms of the deep muscles here, so the deep muscles on the right side with the rhomboides minor and major, that's another thing that's going to be on the mini practical this week. If you just look at this, right, we can talk about what is the origin and insertion of these 2 muscles, the rhomboides. What's the origin would be the spinous process of these vertebrae. Which vertebrae are we talking about here? We're talking about thoracic vertebrae. There might be a couple of cervical vertebrae a little bit up here, but thoracic vertebrae. So basically, it's associated with the scapula here. It's going to be pulling the scapula medially and posteriorly, and the medial border is the insertion. So the muscles on the right insert on the medial border. The muscles on the left originate on the medial border of the scapula. So it's this pulley system here where you can activate one muscle or both muscles, and it will produce a similar or a combining effect. And so I did this for you too, where I haven't labeled the muscles, and so you should be able to do this over and over and over again. When we get down to the triceps muscle, I'm going to tell you that there's 3 triceps muscles head. There's a lateral, long, and a medial head. This one that I'm pointing to is the long head. That's the lateral head. And then there's a little bit of a trapezius muscle right here that you can see. Maybe that's called the medial head. So the upper limb muscles there are basically either moving the scapula and the humerus or stabilizing the scapula and the humerus, depending on what you want to do. Let me see here. So we've talked about the rhomboides major and minor. We've talked about the trapezius. We haven't talked about the pectoralis minor. You should recognize where the pectoralis minor is. It's deep to the pectoralis major. It's stabilizing, or it works with the with either depressing the scapula or stabilizing the scapula or elevating the ribs, depending on what you want to do. Right? So here's an example where it would be basically a scapula stabilizer or a rib elevator would be the one there. The insertion is the coracoid process of the scapula, so that's that inferior process in the scapula, and then it originates on the ribs. So here's another example of it basically not following the rule of origin, insertion, and action that I laid out for you at the start. Another muscle that we haven't talked about and is reasonably relevant or obvious there is the serratus anterior. Its cousin is also has the serratus posterior, and I don't think the serratus posterior is on your list. The ribs are the origin. Insertion is the scapula here, so in other words, it reaches up, inferior portion of the scapula, and it's going to be either stabilizing the scapula or elevating the ribs. So the serratus anterior and the pectoralis minor do very, very similar things. Down to the arm, we have the pectoralis major and the biceps brachii. The biceps brachii here are these three, and the deltoid here. These are flexion, these are strong flexors here. Now, if you look at the pectoralis major, the entire set of the pectoralis muscle does not flex. Some of the muscle flexes. There's other movements too. So any muscle with so many origins here, the pectoralis major will originate down by the xiphoid process all the way up to the clavicle and the AC joint. So it's got a ton of origins here. These are some extensors here. So these extensors include particularly the triceps brachii. Now, if you look at the pectoralis major here, there's a flexor and an extensor. Why is that? Right? Because it's such a broad muscle. Abductor and adductor. Look at this pectoralis major. Here is another example there. So abduction and adduction, medial rotation, lateral rotation. If you look at this last group right here, the medial rotation and lateral rotation, that's of the humerus. And so this is medial rotation, this is lateral rotation, and the two muscles of the rotator cuff laterally rotate the infraspinatus and the teres minor. Medial rotate are the subscapularis. And I thought that the supraspinatus did too. I'll check that. But the rotator cuff muscles there are going to be they will help with the rotation of the head of the humerus. Pictures. Just showing you some pictures here. Now, on the left-hand side in the superior part right here, we have the pectoralis major, and I said that the pectoralis major has a bunch of origins here. So now the list of which of the following would be origins of the pectoralis major, and it would start with the scapula, perhaps the AC joint, the clavicle, perhaps the AC joint, all the way over to the entire sternum here, down onto the ribs. So the pectoralis major has a bunch of origins here, and it merges, they all merge right to the anterior humerus. And you can see the anterior humerus right there. So on the right-hand side of this upper left diagram here is superficial, and on the left there's a little bit of reflected muscles. So on the right-hand side is superficial, a little bit reflected muscles. When the muscles produce simple movements, those are the ones that are really important. Right? Those are the ones that I'm definitely going to ask about. So what are some simple movements here? So there's abduction and adduction, flexion and extension. Those are simple movements. Those are really, really easy to ask about. Muscles that can do multiple things here. I try to just talk about worrying about one thing that it does. For instance, the deltoid muscle can do a number of things, but one thing that it definitely does is abduction. Right? Muscles that attach to the arm and to the thorax, these two muscles, they sort of work in opposition to one another. The pectoralis major and the latissimus dorsi. The latissimus dorsi inserts on the medial portion of the humerus, and it is an adductor. So the adductor is the latissimus dorsi. The deltoid would be the abductor. More pictures here. Now this is the deep view of the scapula. Here we have the supraspinatus, the infraspinatus, the teres minor, and the teres major. So there's 1, 2, 3, 4 muscles right there. Which muscle can't you see from this view? This is another question that I would ask. Look at this picture. Which muscle can't you see? That would be associated with the rotator cuff or the scapula, and that would be the subscapularis. Medially from there, if you look here, there's also the teres major and the teres minor. Right? Which muscle couldn't you see? And that's the subscapularis. So this is an anterior view of the shoulder here. So you have the AC joint, right there. You have the coracoid process, and this is the scapula, the subscapular fossa right here, and the subscapular fossa then, the muscle then inserts on the lesser tubercle of the humerus. So now, what is that going to do? It's going to medially rotate the humerus, and it's also going to pull the humerus medially, generally. Why are the different actions here? It depends on what other muscles are doing. If you look at this point right here, the greater tubercle, so just from this diagram here, you can already tell me, we can talk about insertions and a couple of different muscles here. So the supraspinatus, the infraspinatus, both insert on the greater tubercle. And then what are the next muscles here? The next muscles are the teres major and the teres minor. But we have three muscles right here that clearly show the insertion. And I'm presenting 5 muscles, talk about the only 4 muscles of the rotator cuff, and don't worry about why there's 4 versus 5. This group right here at the bottom are the 4 muscles that are associated with the rotator cuff: the teres minor, supraspinatus, subscapularis, and infraspinatus. When you're talking about those muscles here and the movement of those, right, circumduction is characteristic of the shoulder, and that is an incredibly complicated movement involving a whole bunch of examples of muscles. And I wouldn't ask you about that movement, which muscle or muscles move that, unless I were to include all the muscles of the shoulder and then one muscle of, let's say, the sartorius or something. So which one doesn't belong, basically. So that's the only thing that I might ask you about. Again, on the lower left-hand corner, the list of muscles of the rotator cuff. If you look at the insertions here, we talked about the greater tubercle here of the infraspinatus, the supraspinatus, the lesser tubercle, the subscapularis, the greater tubercle is the teres minor. Very clear to see where the origin of these guys are. The name tells you where the origin is. The other part of the origin might be the medial border of the scapula as well. So for these 3, it's this individual fossa and also the medial border. The teres minor is the most inferior one, and so that inferior border or the lateral border would be the one. So the inferior angle, or the lateral border, that would be those things. If you look up here at the list of origins for the pectoralis major, there's a bunch. Right? Now, here's an example where I can ask you any of these things, including costal cartilages, abdominal aponeurosis. What is that? That is essentially the epicranial aponeurosis, but I wouldn't use that term. I would use, because that is not on the list, I would use the linea alba, the clavicle and the sternum. All of those are origins there. The intertubercular groove, the anterior portion of the humerus and the head of the humerus, is the insertion. Now, the pectoralis major is anterior on the humerus. The latissimus dorsi is going to be medial on the humerus, and so the latissimus dorsi is doing something slightly different than the pectoralis major. And then the most obvious insertion here is starting at the top here is the deltoid muscle with the deltoid tuberosity. How does this muscle with a single insertion have so many actions right here? Well, we have 3 different parts of the deltoid muscle. There's an anterior, there's a lateral, and a posterior part. And if you activate just the posterior part, you produce one movement. If you activate all 3 in unison, then you produce this movement. And so that's the reason why there's it. Generally speaking, again, I'm going to be going for simple actions. And I'm going to focus on when the muscles are producing simple actions. Here's more pictures. The next one is going to be the one I'm pretty sure that doesn't have the labels. Right-hand side is deep. Now, one of the things that's missing here, the ribs are the deep dissection here is, we moved the rhomboides muscles here. And this one removed the rhomboides muscles as well. Oh, I didn't take that out, but I didn't take the labels out. Okay, so that is muscles of the shoulder. And now let's talk about muscles. It says movements at the elbow, right? Now, if you're talking about the elbow here, you got to be more specific. So where are the two insertions going to be? There's going to be one insertion at the radial tuberosity, and there's going to be another insertion on, what's this bump right here? It's a process. The olecranon process. Those are going to be the two main insertions here. So they produce this, and then what's this? Or this?
Pronation, supination.
Which one is pronation? Pronation
Supination.
and supination, and then what's this? It's just an excuse for me to
Phalange.
flip you off. Oh, but what's this?
Opposition, reposition.
Opposition and
Opposition,
reposition.
reposition.
Good. All right, so those are the movements that we're talking about here.
Not bad. Good.
Those flexors include the biceps brachii, the brachioradialis, and the brachialis. Those are synergists of those three. The prime mover is the biceps brachii. The triceps brachii doesn't have a synergist sort of prime mover. They more or less essentially do the same thing. They all do the same thing. The Anconius is helping with the, I don't know if the Anconius is on your list. I don't think it is. But supinators and pronators here include the biceps brachii, and guess what this does? Supinator, right? Guess what the pronator quadratus and the pronator teres does? Right? So some of these muscles are really easy. The actions are very easy to identify. Let me see here, this anterior view of the muscle, of the right arm muscle here, the long head is lateral. So the long head reaches up through the intertrabecular groove. It doesn't insert there. It goes through the intertrabecular groove of the humerus, and it goes up onto the supraglenoid cavity, or the process there, on top of the glenoid cavity, and it originates there. The short head of the biceps brachii attaches on the coracoid process, and they both insert on the radial tuberosity. They go along with the brachialis, which originates on the humerus and then inserts on the radial tuberosity. So this is the lateral, or anterior muscles here, and here are some lateral muscles. You see now this lateral muscle, this lateral view here, looking at like how would you tell this, right? So this part right here is definitely the deltoid muscle. We have part of the scapula of the spine with the clavicle right here. You're going down to onto the humerus. This muscle right there is the brachialis. That's right in the middle. To the right of this picture right here is the biceps brachii, and that's the long head because that's lateral. And then to the left, there's three triceps muscles. There's the long head, the lateral head, and the medial head. Which head are we looking at here? Am I pointing at? This is a lateral view, so this is the lateral head. The long head is posterior, and then as the name would indicate, the medial head is the shortest and smallest, and that is medially. So in this case, then you can't see all three of the triceps muscles of the heads. More identifications here. One thing about this diagram here is that, obviously on the left-hand side is superficial, but on the right, you have the ribs that are cut and reflected. They're removed here. So this is the subscapularis right here. The long head and the short head of the biceps brachii. So these series of slides then talk about, there's O, I, and A here, and we'll talk a little bit about what the origin, insertion, and action is. So in terms of the biceps brachii, both of them insert on the radial tuberosity. the long head, supraglenoid tubercle, the scapula, and the coracoid process of the scapula. I've already said that. And the main thing is going to be flexing the radius here, flexing the radial tuberosity. Right? The rest of the arm is going along for the ride. Because sometimes people will say to me, but look, you're moving your hand. And I'm absolutely moving my hand. My hand is going along for the ride though. So my hand is moving now, right? So I'm waving to you guys, and my forearm is not moving, right? So now both my forearm and my hand are moving, but now I'm activating all of those muscles that are involved. Am I looking silly right now? All right, so John, want me to keep looking silly? So all of those muscles, so now I'm only worried about the muscle associated with flexion here. And because the hand is going along for the ride, that's not activated. Those muscles are not activated. So don't get confused. The brachialis, the distal shaft or diaphysis of the humerus, we're going to say that it does insert on the coronoid process of the ulna, but the lateral portion of the ulna, and flexion of the ulna. Brachioradialis, flexion of the radius, insertion of the styloid process of the radius, that's much, much more distal. Of these three, which one is the prime mover, the biceps brachii, which is the most distal one, the brachioradialis, right? So questions like that. Three heads of the triceps brachii, there's the long, lateral, and medial head. Here is the case for the, and just so we're clear here, this part right here is the medial head of the triceps brachii. This would be the long head, and then the lateral head would be there. It is going to be extending the ulna. The olecranon process is going to be common here. What's different? The difference in the triceps brachii is going to be the location of the origins. So the posterior surface of the humerus for the medial head, the long head, the infraglenoid tubercle of the scapula, the lateral surface of the humerus. Those are the three origins, and that's where the triceps brachii differs. Because if you look at the action extending the ulna, extending the ulna, extending the ulna, olecranon process, olecranon process, olecranon process. So look for differences between these muscles in addition to the names, because that's one simple area to ask. Another thing to recognize is that if this is the right side of the body, right here, this would be the lateral head, and this is. If this is the left side of the body, then we have a messed up hand. But if this is the left side of the body, right, then this would be the medial head. So make sure you pay attention to that. The lateral head is going to be associated with the pollex, and the medial head is going to be associated with the pinky, or phalanx number 5. In between is the long head. Now we will talk about a little bit about wrists and hand movements. There's a ton of those. Right? There's not a lot of pictures. I don't have a lot of questions on these parts, these hand and finger movements, because they are so complex. And again, now this is beyond the scope of this. I think we'll all agree that I've already gone through a lot of muscles today. Do you really, really want me to go through 20 or 30 more muscles of the arm than the wrist? I don't think so. But what are some examples of them? So first of all, if we're talking about muscles that are on the anterior surface of the forearm and the posterior surface of the forearm, here we're talking about extension and flexion here, and we're not talking about this, unfortunately. We talked about the carpal ligaments. What happens in your hand is that the muscles are on your forearm here, and they reach down and they insert oftentimes on your fingers or on your phalanges or on your metacarpals and sometimes on your carpals. So that if you're moving your hand this way, it might insert on the metacarpals, it might insert on the carpals, or it could also insert on the fingers, right, or the phalanges. So if you look at these anterior forearm muscles here, the flexor carpi radialis, the flexor carpi ulnaris. So look at the name. First of all, they're both flexors. The carpi is one part of the name, and ulnaris versus radialis. So look at those. What do they do? First of all, they both flex the hand. They flex the hand or flex the wrist. What is the the difference between the origin here, the humerus, the medial humerus, and the ulna here, and the humerus. So these are both very similar, what's called origins here. And what are their insertions? We're talking about carpals here and metacarpals. So those are the differences there. So the flexor carpi radialis is going to be lateral to the flexor carpi ulnaris because the flexor carpi ulnaris is more associated with the ulna. We talked about the brachioradialis already. Look at these two muscles right here, or these last three muscles. The palmaris longus, I don't know if I have any questions on that, but the last three, pronator quadratus, teres, and the supinator muscles, those are pronator or supinator muscles, right? The palmaris longus helps with moving the wrist. But let's worry about the teres and the quadratus here. So first of all, look at this one right here, the medial epicondyle of the humerus. So now this is the right hand here, the medial epicondyle of the humerus, and it reaches over and across onto the lateral head of the humerus, the lateral diaphysis of the humerus, and that is the pronator teres. So the pronator teres is proximal to the, or adjacent to the elbow. Okay, so that's the first thing. The pronator quadratus is adjacent to the wrist. The pronator quadratus, the origin will be on the ulna, and so what are we doing here? We're talking about moving, what are we moving here? We're moving the wrist, and if we're moving the wrist, the ulna doesn't move. Wait a minute here, not wrist, we're moving the radius here, I'm sorry. We're moving the radius, the ulna is not moving right here. So if I'm moving my arm pronation right there, those two muscles, the pronator quadratus and the pronator teres, are operating. Now, which one is distal? The pronator quadratus. The pronator quadratus is associated with the wrist. The origin will be on the ulna, the insertion will be on the radius, and when it contracts, it helps move the radius in a pronating way. There's also the supinator. The supinator is associated with the elbow here, and so let me back up. We have the pronator teres, that's associated with the elbow, and the supinator is associated with the elbow. So that we're starting in the lateral humerus here, and where are we going to insert? Here, we're going to insert on the radius, right here, adjacent to the radial tuberosity, and what is it doing? It's helping do that. Right? So it's helping rotate the arm open back to anatomic position. Another thing when you're just generally looking at the muscles here, so this is flexion, this is extension, so movement of the hand, flexion or extension, so the flexors are in the anterior forearm, extensors are in the posterior forearm. The term flexor digitorum will be flexors that will be moving the forearm anteriorly, and particularly closing the wrist. Extensor digitorum will be opening the wrist, or opening the hand rather. Extensor digitorum, I just mentioned that, that's going to be opening the hand, extends the fingers and the wrist. I don't know why, I don't know how these numbers got on here. I don't know who drew them. I drew them, but I don't know. Extensor muscles are on the posterior portion of the forearm. Flexor muscles are on the anterior portion of the forearm. This is like it's like Mrs. Gaspar's son drawn on that. So we have a couple of these muscles here, brachioradialis, pronator teres, pronator quadratus here, these flexor muscles here, these, again, flexion and extension, right? Carpi muscles are associated with carpals, radialis versus ulnaris. Radialis will be lateral, ulnaris will be medial. Okay? These muscles all more or less are parallel. There's not very many muscles that run perpendicular to us. Here are the pronator muscles. Now, which muscles are going to be associated with opposition? Right? I don't think,
Is it the opponent's? Opponent's policy?
no, so I'm trying to remember, I don't think that these muscles of the hand, that these intrinsic muscles of the hand are on the list. I'll check this tonight, and I'm gonna stop right here, and I don't remember what is on the list right now. So I don't think that these last two slides are on the list, so we're gonna stop right here. I'm gonna check the list, make sure that I don't screw up, and then we will pick up tomorrow. So tomorrow, here's what we're gonna do. First of all, I will offer to collect the permission slips for the field trip tomorrow.